My name is Bala. I'm one of the co-founders of Bugworks. We are a biopharmaceutical startup company formed about 8 years ago, and we are located inside the C-Camp biocluster here in Bangalore. We are basically a drug discovery company stitched together from a lot of us ex-AstraZeneca, and we bring together probably over 250 years of drug discovery experience with us. And today we are addressing perhaps two humankind's worst scourges. One being the antimicrobial resistance, the silent pandemic, the other being cancer. Both together claim a lot of lives and cause severe economic losses to around the globe. Let's first talk about the AMR and what Bugworks is doing. AMR, the whole concept, why AMR today is a big issue, antimicrobial resistance. The world benefited from a plethora of life-saving medicines for nearly 5-6 decades in the last century. And the world didn't really require any new solutions for a long time. But we started losing the plot perhaps a couple of decades ago, where because of overuse, because of misuse, because of suboptimal use, whatever we might say, many of the bacterial organisms which used to be cured by the previous generations of antibiotics are now not being able, are refractory to these antibiotics, basically antimicrobial resistance. The problem with antimicrobial resistance is that it is not just an infection problem. The moment you have resistant bugs, your entire clinical practice is affected. A simple dental procedure is compromised now because you could actually end up with a resistant microorganism which can cause heart failure from your, the leak in the dental procedure to, complicated surgeries, heart valve replacements, bone joints, etc., which intuitively you may think, what has infection got to do anything with these clinical procedures? And yet, every bit of our clinical practice today in the last 100 years its entire success lays on the fact that we have successful antibiotics. And we lose the plot on antimicrobial resistance, we actually lose the entire clinical practice. And that's unfortunately the situation the world is facing today. Bugworks is one of a handful of companies in the world where we've heavily invested into actually finding new solutions for dealing with antimicrobial resistance. We've been very fortunate to be funded by perhaps one of the largest initiatives called CARVEX, which is a US-led consortium funding the discovery of novel antibiotics. Our beachhead is a brand new class of novel antibiotics, which actually is just entered clinical development. And let me say that with an air of modesty, that perhaps this brand new class of a broad spectrum antibiotic is the first of its kind in over 6 decades. Nothing in the last few decades matches in terms of the spectrum that we cover. This is right now progressing through early clinical trials. If and when successful, would actually open up a massive solution space for clinicians around the world dealing with various superbugs that are resistant to many antibiotics. So that's one part of us. The second part of us is in terms of solutions for cancer. One might ask, how did this crazy company come together in dealing with two completely different therapeutic areas? Interestingly, there are some commonalities. In both of these disease areas, the end objective is to kill. In many other disease areas, it's modulation. Like, for example, you want to modulate hypertension, modulate diabetes, etc. But it's infection and it's cancer, your objective is to kill the causative problem. And so there is actually a common denominator. And we've borrowed a lot of the principles, a lot of the ecosystems that we built to deal with AMR, solution space. We've been able to actually build it and extrapolate it in terms of dealing with it. Finding novel solutions for cancer. Cancer, the approach we're taking is an immuno-oncologic approach where we are looking at targets in the, basically trying to alleviate the T-cell mediated immunosuppression and then, bring small molecule solutions for immuno-oncology as opposed to the biologics, which is the most, the more popular ones today around the globe. Two reasons: small molecule is where our expertise is, but we also believe small molecule is where the economics of dealing with a large percentage of cancer patients can be addressed. Cancer afflicts a huge part of humanity, but unfortunately, cancer therapies are accessible to a very small proportion of those patients. And so, by addressing that with small molecules, we believe we can actually make cancer therapy also accessible. So, one of our main objectives for Bugworks as a company is actually make state-of-the-art medicines affordable, accessible to actually LMICs and the rest of the world, along with the major markets. Thank you.